I've worked here as the chief nurse for 3 years. I've moved my whole family to Norfolk, and I'm guessing that you would like to come and work in an organisation that's a tertiary centre, regional leader across many services, that has a vibrant city, by the coast, and rurally too. Now, I could tell you lots of things about this organisation that were all phenomenal, but actually I want you to hear from our clinical leaders, our ward, unit and department managers and all of their teams about the 365 reasons why you want to come and work with us. It's a great place.
I've been a nurse for about 2 years now, working in this department, and I've loved every minute of it, really. Our patient groups are normally COPD, asthma, your pulmonary fibrosis, your cystic fibrosis, and a lot of sort of type 2 respiratory failures as well. And we do a lot of discharge planning with the palliative team, and we look after very acute patients, and normally a lot that go up to escalation in ITU as well. This ward had definitely given me the specialist skills with a lot of training. We work really with all our specialist roles in advancing our care of, non-invasive ventilation or chest drain care. I came straight from university and straight into the deep end of acuity, and I got all the necessary skills from all the relevant trainings given to me here, guided by our expert team, by our doctors, by our specialist nurses, and the general training you get from the trust.
I want to progress, hopefully, but at the minute I do like being a HCA because of the one-to-one that you can have with patients. And I really liked respiratory because I was just so interested in it. So I'd like to be able to do like medication and just to feel like I've helped out that extra bit more. Just talking to a patient, that can really make their day. So it's just nice that helping others out as well as a team if we've done a really good job of a day and getting loads of things done. This team is really lovely, they're all really helpful.
The RIU is the Respiratory Investigation Unit, and that's where we undertake a number of different endoscopic procedures. A lot of patients are very concerned or frightened about having it done, and so it's very nice to be able to put them at ease before the procedure, look after them during the procedure, and afterwards be able to get the feedback from them that it wasn't as bad as they thought, and that they really appreciated you being there for them at that difficult time.
I've always wanted to work for the NHS, so it's been amazing to sort of got the opportunity. Well, having been really new to the team, everyone's been really friendly and they're always like, oh, are you okay? Do you know what you're doing? Everyone's been really supportive, and if I don't know something, I feel as though I can say to someone, oh, this may sound silly, and everyone's like, oh no, that's not silly, this is how you do it or whatever. So it's been a really nice environment to learn, because I feel as though I can ask questions and not, people think, So yeah, no, it's been really lovely.
I was a bank healthcare assistant and I worked all across the trust on different wards. Came to bank on Hethel and really enjoyed it in respiratory. The team were really supportive and encouraged me to come and work with them here. And then I carried on, did the training here, and I'm now a registered nurse and associate. I just think there's so many different elements in respiratory, so many different specialities that you can go on to learn about. And the acuity of the ward as well, with the ventilation and the NIV, that really interested me. And again, the team were just so lovely, really supportive, and it was just, a place that you'd want to come and work and feel supported. Everyone used to ask me, what were you going to do when you grow up? Do you want to be a nurse like your mum? And I always said no, and I kind of fell into it doing home care and found that I actually just loved to help people. I thrive off helping people, I really do, and coming in and making a difference, even, from a small difference to a really big difference to people, that's what I live for.